The Canadian government on Monday updated its travel advisory for 9 Caribbean community nations among a list of countries across the world, and the Zika virus is responsible. The Canadian government has urged its citizens traveling to the Bahamas, Belize, Guyana, Haiti, Jamaica, Suriname, St. Lucia, Trinidad and Tobago, and our nature island Dominica to exercise a high degree of caution, and it suggests that pregnant women and those planning a pregnancy should avoid travel to these countries. In March of this year, the Centers for Disease Control in the United States also added Dominica to the list of countries that some U.S. citizens were advised to avoid amid the spread of the Zika virus. Back in May, Chief Medical Officer David Johnson had reported that the number of people affected had risen to 28, with 2 pregnant women included. And during a press conference, Johnson had hastened to clarify that the confirmed cases do not mean the affected were sick at that time.
We take samples, and those samples are sent to Trinidad, to the Caribbean Public Health Agencies for confirmation. The turnaround time is usually around 5 days to a week, but most times by the time we get the results, the persons are in fact asymptomatic. So in fact, all of the persons who I referred to are asymptomatic at this time. In other words, they're not presenting with any signs or symptoms of the Zika virus.
And with regards to the cases of pregnant women affected, Johnson had said that these cases were of concern to the Ministry of Health and were being monitored very closely.
We have a complete team of medical personnel specialists who are monitoring these individuals to ensure that they providing, I should add, psychosocial support to the individuals and doing all of the necessary investigation and monitoring by our expert.
Johnson had added back then that at that time, no complications had been identified in terms of the pregnancies and that there had been no reports of admissions or deaths in Dominica from the Zika virus. An update on the number of cases has not yet been released, and CBN4 attempted to reach the relevant authorities for comment, but they were unavailable.